Our biggest study right now, it's more of a longitudinal study, and we're having youth baseball pitchers come in, and we are calling they throw a simulated game. So they're throwing up to their age-restricted pitch count, and we're doing motion analysis, so we're trying to see what their mechanics are doing when they're fresh, first inning, and then how their mechanics change as they approach that last inning of their pitching. So we're kind of doing some range of motion screening, just basic screening to see if we can say, okay, this is what's going on. These are some things that we can implement that will hopefully prevent injury.
From the research you've done, what have you noticed about kind of the younger arms and the dangers that might be out there?
Really, I would say the number one issue is that when people think of throwing, they think of, oh, I've got to strengthen my arm, I've got to throw from my arm. But if we would look at throwing from the legs, then that's, I think, where we're going to prevent some injuries. So we don't typically look at that with youth, and we see that their lumbopelvic hip complex or their core region is weak, and they're not able to support their body weight, or they're not able to control. So we see that, okay, if they have a lack of control there, and we see that when they maybe they open up a little too much on foot placement, then their arm tends to lag behind. So I would say that would be our biggest issue, is hip mobility, hip range of motion, and lumbopelvic strength.
What have you noticed about the number of games played in the seasons? You're talking to me about maybe it might be good to tell me about that, about taking a season off if you have trouble. Typically, youth baseball, they'll have a fall season. So now we have fall season, then we're going to have the spring season, which is the big time spring ball. Then they have summer travel ball. So we look at baseball as 3 seasons, so now it's a year-long sport. Ideally, 3 seasons is too much. And so we're following the recommendations of Dr. Andrews with ASMI, and it's like, okay, we don't need to play all 3 seasons. Let's look at playing 2 of the 3 seasons and then taking time off, meaning you're not playing baseball, you're not throwing. You're playing something else, but you're not throwing. What are the dangers of wearing that arm down, playing 3 seasons a year, starting from 10, 11, 12 years old as you hopefully get to be a high school player one day?
Well, I think it's more of the fatigue issue. So the body is a fine-tuned machine. So if we're performing the mechanics correctly, then you have the older pitchers that you see in the pros, and you're like, well, they never had that. Well, if they have the proper mechanics, you're going to be okay. But when fatigue sets in, then maybe we don't rotate our torso right in time. Maybe we don't keep our arm at the optimal position. And then that's where we're starting to see the breakdown. So I really think it is the element of fatigue, and we have to catch the fatigue before the mechanics break down.
Yeah, talk about just the studies that you guys do here with the back there, and kind of how it works and how it's able to maybe kind of open up a whole new world as far as preventing injuries.
We do a lot on youth throwing, not just baseball. We do softball. We've looked at lacrosse kids. We've looked at football kids. And really in the research field in the sports medicine, there has been limited data available for youth. We look at the mechanics. We know the mechanics of collegiate. We know the mechanics of the pros. But we don't really know how a youth's mechanics change when they're 10 to when they're 13. So we're trying to say, okay, can we catch? We know that if the arm drops, then we're going to start having some higher chance of injury. So what are things that are going on that's causing that arm to drop? Or is it as they grow, do they get tighter in their hips? They lose that hip range of motion for a couple months, and that throws off their mechanics. So we really want to say, okay, can we describe your typical 10-year-old? Can we describe your typical 11 or 12-year-old, 13? As the children mature, what's changing in their mechanics? And hopefully with some of those data that we're producing, we'll be able to answer some of those questions. When
you talk to parents, do you ever have the how much is too much conversation as far as giving the kids a break?
We do, and like I said, I stress the only 2 of the 3 seasons. But the biggest thing, I know we have pitch counts, and those are working, but you know your child. So when you see your child go out on the mound, go out on the field for whatever position, look at their posture. So it's like when you start to see a little bit of change in their posture, like mom and dad know, oh, he or she's tired. They can tell by looking. That's when they're getting tired, and if their posture is not correct, just standing there, we're going to start to see the breakdown in the mechanics. So usually when the parents are asking, well, how do I know? Because the kid wants to keep playing. But, you know, when I see them get on the mound and they're kind of slumped over a little bit, and it's the fourth inning, but they haven't been doing so well and throwing in a lot of pitches, then I'm thinking, I don't care how many pitches they have left. Maybe it's time for us to sit them down and rest them.
Yeah, I'm sure all the parents who pay for these travel ball teams and send their kids to the lessons, the ultimate goal, I'm sure, is to at least get them to that high school level where they can be competitive. But you think we might be at risk of jeopardizing these high school careers by doing so much at a younger age?
Absolutely. It's when you see the athletes, the collegiate athletes, go in their freshman year, junior year for surgery. It's not what they've done at the collegiate level. It's what they've done prior to. So it's really what they're doing at 10 years old, or even as far as